Hi, I'm Lindsay Mayberry, and today I'm going to talk to you about shock. What is shock? Shock is a critical condition that is brought on by a sudden drop in the blood flow in the body. The circulatory system fails to maintain adequate blood flow, sharply decreasing the delivery of oxygen and nutrients to the vital organs. Shock is a medical emergency and is common after a major injury and certain types of bacterial or viral infections. Common symptoms of shock are altered conscious state, restlessness or irritability, pale or cyanotic skin color, low blood pressure, rapid shallow breathing, cold clammy skin, rapid weak pulse, dizziness, fainting or weakness, nausea and or vomiting, and excessive thirst. There are different types of shock. There's cardiogenic shock. It's caused by heart damage. Distributive shock is caused by vasodilation. Septic shock is caused by a bacterial infection. And obstructive shock is a physical obstruction of blood circulation and inadequate blood oxygenation. In the top picture, it shows normal lungs, normal heart, adequate blood flow, and nothing wrong, no blockages, no vasodilation. It just shows a normal, healthy person at the top. In the bottom corner, it shows cardiogenic. If you look in the left ventricle, you will see a red X. That red X is indicating some sort of heart damage or issue causing shock. If you look at the hypovolemic shock, you can notice a dotted line. And that dotted line indicates low blood volume causing shock. If we look over here, this is obstructive. And if you notice in the obstructive, there's red X's on the heart and the vasculature. Those are indicating obstructions. And if you look at the top, the lungs are not receiving any sort of blood flow. So that means the blood can't get oxygenated and causing a big problem. If you look at the end, this is the distributive shock, and the black dotted lines around the outside are indicating vasodilation, causing a drop in the blood pressure, which is causing shock. On this slide, it's showing the hemodynamic monitoring and findings. To monitor the hemodynamics of a patient with shock, it is recommended to use a Swan-Ganz catheter. and a blood pressure cuff to monitor the patient's blood pressure regularly. It shows all the types of shock on one side of the chart, and it goes over the systemic vascular resistance, the cardiac output, the central venous pressure, the pulmonary artery wedge pressure, and the mixed venous oxygenation saturation. For the distributive, it shows septic and neurogenic shock. Is how it breaks down that category. For septic shock, the systemic vascular resistance is decreased. The cardiac output is increased or normal and is rarely decreased. The central venous pressure is decreased or normal. The pulmonary artery wedge pressure is decreased or normal, and the mixed venous oxygenation saturation is decreased or normal. For the neurogenic shock, it is decreased, which is the central vascular resistance. The systemic vascular resistance, I'm sorry. Also, the cardiac output for the neurogenic is increased or decreased. The central venous pressure is decreased. The pulmonary artery wedge pressure is decreased. And the mixed venous oxygenation saturation is increased or normal. For hypovolemic shock, the systemic vascular resistance is increased. The cardiac output is decreased. The central venous pressure is decreased. The pulmonary artery wedge pressure is decreased. And the mixed venous oxygen saturation is decreased. For cardiogenic shock, the systemic vascular resistance is increased. The cardiac output is decreased. The central venous pressure is increased. The pulmonary artery wedge pressure is increased. And the mixed venous oxygenation saturation is also decreased. For the obstructive shock category, is broken down to cardiac tamponade and pulmonary embolisms. The cardiac tamponade and pulmonary embolism both have an increased systemic vascular resistance. They both have a decreased cardiac output. They both have an increased central venous pressure, and they both have a decreased mixed oxygen saturation. Where they differ is the cardiac tamponade has an increased pulmonary artery wedge pressure, and the pulmonary embolism has a decreased or normal pulmonary artery wedge pressure. The pharmacological treatment for shock is the first line of treatment for all types of shock. Is going to be IV fluid resuscitation in efforts to raise the patient's blood pressure as quickly as possible. The administration of medication such as epinephrine, norepinephrine, and dopamine, in addition to the IV fluids they are already receiving, to try to get the patient's blood pressure to raise more and to get blood flow to the vital organs. X-rays, blood tests, and EKGs are also performed to determine the different types of shock and the appropriate treatment for that shock. Arterial blood gas and mechanical ventilation. Arterial blood gas values for patients in shock can start out as a respiratory alkalosis and then show both a respiratory and or a metabolic acidosis from the body tiring out from the shock. Mechanical ventilation should be used for two reasons for shock besides respiratory failure. And the two reasons are to allow the respiratory muscles to rest to prevent fatigue, and to free up the blood that is flowing to the respiratory muscles to help it work and allow that blood to go elsewhere to like the other vital organs. Excessive positive pressure ventilation can cause a decreased venous return and can be detrimental to the patient, especially to a patient who's in hypovolemic shock. So you want to make sure using positive pressure ventilation you're careful of venous return. Make sure you're monitoring that carefully. Thank you for watching, and this is the Works Cited.